the other areas that I love about our shelf partners or our solutions partners is that they're willing to get into the trenches with us and help to tailor their software and their programs to meet the needs of the different CBOs. So I think that that is a really unique benefit that we have because we have stronger voices together, right? So if we can collaborate on a better solution or a modification to an existing solution, and they're willing to listen to that because we are, the collective experts in that area, I think that that is the strength and the benefit that comes from that is just unbelievable.
So finding these partners are so critical that they're also very mission driven, willing to listen to how things are done on the front lines and how we work. Hello, everyone. Welcome back to the Impact Collaborative podcast. My name is Dr. Claire Wang. I'm the Executive Director of the Impact Collaborative. And today we're going to talk about connecting CBOs with the tools of tomorrow. Joining me today is my colleague and friend, Lisa Harris. She is the Director of Membership at the Impact Collaborative. Welcome.
Thanks, Claire. Great to be here.
So we wanted to spend a little bit of time talking about how we got to work together and our concept of the Impact Collaborative as we are starting our first phase of rolling out this idea of fostering a ecosystem where CBOs, nonprofits in the community can really amplify their impact together. So I wanted to start by asking Lisa. She came to the Impact Collaborative with a very interesting entrepreneurial background. Lisa, can you talk a little bit about your background, your expertise, and why it is so, for me, it's so perfect that you landed in this role of working with members who will be engaging with the collaborative?
So I have 17 years experience as an entrepreneur, and one of the unique aspects of my entrepreneurial experience is that I completed a full cycle in my business. So I started my business from scratch and built it up to a point where I was acquired by a snack company. And that was really interesting because throughout that journey, I had to wear so many different hats. I bootstrapped my business from the beginning till I was able to grow it to a point where I was able to start hiring a team. And once I did that, it really freed me up to do the things that I was best at and that I was most passionate about. And from that point on, I was able to really excel at that. And I learned a lot from that experience. I learned about pivoting, adapting, and one of the reasons that I think that my particular skill set is valuable to CBOs and to this particular position is because we are all entrepreneurs. Everyone that I've met so far in my journey through the Impact Collaborative has the same skill set. They might not think of it in the same way that I thought of it at the time, but we all bootstrap, we all, work with such a small or non-existent budget and figure out a way to be the most successful version of ourselves or of our business. It's something that's just really valuable, and I hope that I'm able to help others with that mindset.
Yeah, I totally see the alignment. Now we've been working together for almost 2 months now. That entrepreneurial background and very scrappy problem-solving skills is so relatable in the nonprofit sector, whether or not you're growing and scaling a snack and cookie business, or if you're trying to make sure, let's say you're supporting people coming out of incarceration and trying to pave a new life, or you're supporting LGBTQ youth struggling with mental health. We all start with this passion, right? And we wanted to make sure that our mission, we're being able to do the things that's necessary in order for our mission to be successful. But meanwhile, we all have all these constraints. We don't have endless budget. We also have a lot of different guardrails around. We have to do things in certain ways that, they're always with constraints. I often say that people serving the front lines, people who are running a nonprofit businesses are among the most creative problem-solving professionals I've ever met.
Yeah, I mean, you have to be. I imagine just like in any business, you have to be able to be the most resourceful version.
Yeah.
And one of the reasons why I think that the CBO hub and or soon to be hub and our solutions are so valuable because those solutions allow a leader to do what they love best and what they're most passionate about. So if you can utilize a solution or a resource that we can offer, even if you are on a very restrictive budget, the benefit is tenfold because it frees you up to do what's most important to you and what you're most passionate about. I imagine when someone goes to school to become a social worker or
Yeah.
a psychiatrist, psychologist, they're not imagining the burden of countless hours of paperwork and administrative burden, and you're just, like, ready to go and dig in there and start helping people, but then you're just so overwhelmed with these processes that you have to, and, participate in that you can't kind of get out of your own way, right? You're just burdened. So the tools really help a lot and the resources that the hub can offer our members.
Let's talk about that a little bit more. Strategically, we look at the Impact Collaborative. We co-grow these 3 pillars of our strategic plan to really form this perfect circle or donut of the Impact Collaborative narrative, where we will have a learning community, right? So the nonprofit leaders could learn from each other, share the same problem-solving approaches and potentially co-develop solutions. We will love to see that learning collaboration happening. And secondly, we have bringing the business solutions. So let's talk a little bit about that. We have another episode talking about impact storytelling, which is integral part of our IC donut.
Right.
However, I wanted to spend a little bit more time today for us to unpack the business solution portion of it and coupled with learning community. So let's
Sure.
get that started.
Yeah, I'm really glad that you brought that up, Claire. I love the idea of the learning community because not every CBO is going to be wanting to adopt a new product or anticipate purchasing, a new initiative
Yeah.
at the same time. So we can't really rely on just solutions. We also need to provide support and resources, and most of those would be free and super valuable. So I love the learning community because it does exactly that. It offers something that is tangible and adaptable to any CBO, which I think is really important. Because I think what we know from conversations is not every CBO is one size fits all. So
Yeah.
this size CBO might have a particular puzzle piece that's missing, and we can help fit that, but not everyone is going to, be able to adopt the same product in the same way, so the resources that people can gain from the community, I think, are super important.
Yeah. And having a community where you can lean on, exchange ideas is helpful for all of us, right? Regardless of the lanes we're in, and having that peer mentorship is so valuable as well. So as of now, we're really envisioning a couple of things that, for our member organizations. And of course, if you're listening and you're interested, becoming a member of the Impact Collaborative, obviously visit our website. And Lisa will be on the other side to really introduce you to the benefits of being part of the Impact Collaborative. For our members to be part of the learning community, we're envisioning we will have programming such as webinar series, mentorship programs in the future, and of course, some community events where we can workshop. So we have big dreams about that.
Well, one of the other areas that I love about our shelf partners or our solutions partners is that they're willing to get into the trenches with us and help to tailor their software and their programs to meet the needs of the different CBOs. So I think that that is a really unique benefit that we have because we have stronger voices together, right? So if we can collaborate on a better solution or a modification to an existing solution, and they're willing to listen to that because we are, the collective experts in that area, I think that that is the strength and the strength and the benefit that comes from that is just unbelievable.
Yeah, please say more about that because as someone who is um, a tech enthusiast, sometimes I do lament that oftentimes nonprofits, especially small ones, tended to be forced to number one, purchase very expensive solutions that they cannot afford. Two, forced to change your workflow and sometimes the workforce as well in order to fit the workflow that is developed by other large softwares or tech providers. And that may or may not fit. So
Right.
that's an investment that is kind of misaligned, right? You invest your people, time, constrained resources.
Right. Your resources.
So finding these partners are so critical that they're also very mission driven, and willing to listen to how things are done on the front lines and how we work. So consider us as a partnership rather than customers.
Right. Well, I happened to be there when you when you were able to participate in a mock therapy session with Elios. And I thought that that was just so amazing because I had heard a lot about Elios as an AI note taker and specifically for behavioral health and clinician assistance, but I had not seen it in action. And
Mm.
do you want to talk more about your experience? Because I thought it was just amazing.
I would love to. So Elios is one of our first partners of the Impact Collaborative. And they're in the space of scribing. So in behavioral health, so both in the mental health side and the substance abuse side, a lot of the therapy or this therapeutic relationship is based on conversations with your counselor, with your social worker. But oftentimes, we also hear from our clinicians that they're weighted down by the amount of paperwork they have to do. It's already quite a taxing profession because you're taking on other people's burden on your own. The service to sustain, you have to do a lot of documentation in order to fulfill the billing requirements, for instance. So oftentimes you spend 45 minutes with your patient and you spend another 2 hours to write down what you have talked about, what the plan is.
Yeah, that's exhausting. I
It
can't
is
imagine going home
exhausting.
after a long day in the
Mhm.
office or at work and having to transcribe notes and then read them
Yeah.
and make sure they were accurate.
Yep.
That's such a burden. Your work-life balance just is non-existent at that
It's
point.
non-existent. We hear from our child center clinicians that prior to adopting the tool, sometimes they just can't find time to go to the bathroom and have lunch. That is something from the data standpoint, we know that the documentation time before and after the adoption of the tool went from 15 minutes per patient to about 5, and that's drastic. But I also was fortunate to have this opportunity to experience from a patient standpoint. So it's in the training environment, so there's no HIPAA violation. On the other hand, instead of a demo, sort of I'm familiar with this idea of the vendor will come with a demo. I was able to say, well, I would like to talk to the clinician as a patient and to really experience having Elios the listening to our conversation and assist her in her documentation. In the beginning, I thought I was just looking at how this works in action, but I walked away thinking, oh my goodness. Well, so during that mock session, I says mock, but it was quite true. I was very stressed out, starting a new job. So I talked about this with a wonderful therapist at the child center. I talked about imposter syndrome that I'm feeling, my upbringings, the anxiety, but also excitement. We talked about coping strategies and so on and so forth. I did elaborate a little bit more, and just for the fun of it and from my staff. Like, well, sometimes adding a little bit more things in there. Nonetheless, I did witness the portion where documentation was much more seamless, and very much consistent with the evidence base. But I also experienced something different. That is, I felt that the attention that I was getting as a patient, very comforting. My therapist was with me the whole time instead of turning around to type on a computer. She was engaged. I felt seen, and I felt cared for. So being able to have that 100% conversation with your therapist, I believe is what a patient wants. But that's also, I could also see this is what a therapist, a social worker went to school and feel passionate about. is to have a therapeutic relationship like that.
And I'm sure that that really helps a lot and aids in hiring new talent because retention must be astronomically difficult when you're so overburdened, especially when you're just coming out of school and you're really
Yeah.
excited and your balloon is a little bit burst at that point. I imagine that people don't stick with with their jobs for very long, and then
Yeah.
finding new talent must be it is really challenging. But if you can find an employer that actually is thinking about this and applying this as a benefit, that's someplace I would want to work.
Yep. 100%. 100%. It's all about the why and how we show up every day doing what we're needed for, but also what we are good at. So that was quite an interesting experience for me.
Yeah, I on my end, I thought it was really interesting as well because I was one of the things I have been in therapy before because I love therapy and I love being a therapy patient. But one of the things about therapy that I always found triggering was when the clinician would suddenly take a note based on something that I
Oh, yeah,
said,
you
and I
feel
was like,
judged,
"What
isn't
did I
it?
say? What did she find exciting or interesting or
Yes.
piqued her interest?" So I really enjoyed like watching that happen during the session because she was able to make eye contact with you the entire time.
Yeah.
Yeah, it's a great product. I think it's really groundbreaking.
That's right,
They're a
that's
great
right.
partner, and I think they're a perfect example of the type of partner because wasn't there something about didn't they start out with limited, languages, and then because of our feedback, they started adding additional languages, and that's exactly why we choose, work with someone like Elios because they're
Right.
really open to they see the value of our input and our collective
Mhm.
input, and that wouldn't happen without a lot of collaboration.
Yeah. And we have other partners, like, very like-minded, they might not be as established, but this idea of we're able to sort of broker in relationship, and in my dream, I do think that the Impact Collaborative could be a catalyst of, this type of relationship as the norm going forward.
Yep.
So, is there any other shelf partners that really resonated with you?
I love water cooler. At first, when I heard about water cooler, I thought, maybe this isn't really so important because you should be able to tell by looking at someone what they're kind of feeling, if they're happy or unhappy, because we all kind of I mean, most people wear their expressions and their emotions on their sleeve.
Oh, I don't.
You didn't. I do, and I think that's part of the problem, but I do. And one of the things that I thought water cooler I was so interested in they're able to predict employee burnout based on other data that they're able to collect, so they can see what's happening that could trigger disappointment or unhappiness in your job, and I think that that's really so valuable, and again, that really speaks to retention and making sure that the work environment and the work culture is working for everyone.
That is so interesting, and yeah, I agree. I think early on when I heard about the idea of leveraging AI and really look at different things, they connect to, the Outlook calendar, the HR system, but when I talked to a nonprofit executive, she said, "Well, I know who's burning out. Their
Right,
caseload is too high. I don't need any machine to tell me that who is taking on too much."
right.
And I think that is true at the same time.
I'm sure you're right. Although I think that there are a lot of in fact, Eitan Vesely, the CEO,
Mhm.
he shared a story where he was explaining to us that he had just sold his company, and he shared a photo of the day that he sold his company, and it sounded like it should have been a very exciting
Should
day,
be
and
a celebration.
right, a big celebration, and his face in the picture looked very happy, and 2 days later, he ended up in the hospital, and, the stress that he must have been carrying for so long and the unhappiness that he was hiding really attributed to a physical reaction, and that's for me, that's what sold me on the idea of water cooler because no one wants that to happen to their staff.
You're so right, and what resonated with me, the story is a little bit different angle. I oftentimes think about being a manager and learning to be a leader is a lifelong journey. We're always trying to improve. And some people often say, well, somebody just had it or had not. But now we all know that that's not true. We all learn along the way. We make mistake and learn from it. But in this case, in terms of supporting the workforce, I would like to think that rather than make mistakes, hurt people and lose your best talent, I would like to have the insights that's based on data and based on the best practices that other leaders along the way already understood. So, for example, I was quite struck by this idea that the amount of one-on-one time with your supervisor oftentimes can predict that relationship. And you must have heard that people don't leave a job, people leave their managers.
Right.
But I want to be a good manager and good leader, and I want to be able to do things on the day-to-day basis instead of losing someone and learn it the hard way.
Afterwards, right? Well, I think that's really important because you do really learn so much from that one-on-one interaction about each
Mhm.
other, and not only the collaboration that happens through that process, but I think also just being seen as an employee and knowing that my supervisor is interested in what I have going on, whether
Yeah.
it's personal, it's work related, whatever it may be. It's just such a valuable piece that I think a lot of people unfortunately miss, and that also speaks to retention.
Yeah. And so that's a really good pivoting point for me, because back to this learning, collaborative learning community concept, sometimes about how do you run an organization as a business? How do you grow rapidly from a clinician to a business executive? There are tools like water cooler we just talked about, but there are also experiences and things that worked that could share. So one of the things that I talked to Traci recently about what they were doing at the Child Center as an innovation, which we're trying to figure out a way to share with others and have a conversation, is something instead of an exit interview, a stay interview, and really invest in the time to understand people who are currently in your organization performing at different levels, what their experience looks like. So the Child Center invested in building an employee experience department, and conduct these, periodic stay interviews.
That's so smart.
It is so
Yeah,
interesting
I
and makes
love
so
that.
much sense, and I never thought about that before.
No, that's great, and I think that those are ideas that we can share through webinars and different, learning experiences
Yeah.
through our learning community, and that's another resource that we can offer, and we're not trying to position ourselves as experts, we're just positioning ourselves and saying, "This is something that worked that you might not have tried or be aware of, and together, let's kind of cultivate this idea and sort of, like, build out this idea that could work for you," and maybe, have that conversation, so I look really very forward to the learning community because I love to hear other people's stories, and I think stories are such a compelling.
In terms of, like, how do we make it all happen? I know, Lisa, you have a lot of ideas on how to engage your customers, in this case, our members. This customer service part of this idea is so important. And that's also why I'm so thrilled that you brought your entrepreneurial and business kind of background into Impact Collaborative. So, what's on your mind?
So I'm looking very forward to starting to build some relationships with our CBOs, learning more about them because to me the most valuable piece of any position that you could work in is the relationship building and the long-term relationship building. We
Mm,
could meet today and have an interaction, but that doesn't mean anything if we don't try to build on that interaction. So I'm really looking forward to starting to meet more CBOs and enroll them in our website and expose them to our website and start to kind of collaborate and see like how can we help and understanding their pain points and potential roadblocks to adopting a new solution or getting involved in a webinar or um, possibly sharing an impact story. So I really look forward to that. I'm very excited about the future of the Impact Collaborative.
yeah, me as well. And for me, I'm somebody who has worked in multiple sectors, but I work every job into the same job, because I really believe in bringing people together to magnify impact. And sometimes that means not being the expert in the room, or be the one to set up the table and bring people to the table.
Yep.
When the right people are in the room, virtual or otherwise, the right things could happen. So I would love to see that, and I can't ask for a better partner
Oh, thanks, Claire. Likewise.
because of your background in the food and business. We have to talk about our favorite snacks.
Okay. My favorite snack of all time, or can I do salty and sweet?
Let's do salty and sweet.
Okay. My favorite salty snack is Snickers bar.
Ooh.
Hands down, my ultimate favorite. And my favorite, wait, did I say salty for that or
That
sweet?
is a salty
That
one.
is a salty and sweet. And my favorite sweet snack, I would say, gosh, that's
Too
a
many.
tough one. There's so many. I'm a peanut butter fanatic, so really
I can
anything
tell.
with peanut butter. You can tell?
Wow.
I'm not sure what sign I wear that says peanut butter lover, but I am one.
Oh,
Definitely.
I do love a good peanut butter. I would say for salty one, I do like savory snacks, but I would go with popcorn for today. And for sweet, I really love a good macaron.
Oh, nice.
All right.
All right. I didn't know that about you. Now I know.
Well, thank you for joining this conversation,
Oh,
Lisa.
thank you. It was a pleasure. Thank you so much.